Obesity, 300% increase over the last 30 to 40 years. Just 20 years ago, 6% of the American children's population had obesity. So 1 in 15, 1 in 16. So in 30 years, we've gone to now 20%. It took 12 pregnant women from 12 different states in America. One of them through pregnancy and at the moment of birth took the umbilical cord blood from the baby and the mother and screened it for over 5,000 different industrial toxins. The average found in each mother and baby in that umbilical cord blood, 285 different chemicals, toxins, heavy metals.
My older child, who's now 17, she was developing breast buds and she was not even 8. And I went to her conventional pediatrician and they said, oh, this is normal. This is what happens. You could get a period at 8.5 and 9 and that's normal. And I refused to believe that. And we discovered was she had a gluten sensitivity, but her root cause was she was exposed to mycotoxin, which is mold. And all of us were exposed to it. We didn't realize in her room by the air conditioning, there was water damage to the dry wall. And that was causing her mold. And the kind of mold she had in her urine was Zeldaron, which is a mold that mimics estrogen.
Wow.
Endocrine disruptor.
Yes.
Disrupt the hormones, early bud breasts.
And thank God to functional medicine, because with that pathway, we were able to stop her precocious puberty, and she developed completely normally. These things are endocrine disruptors because they're mimicking what your body's used to seeing. And they're just changing her trajectory and pathway in terms of how she should actually show up. Her epigenetics are changing because of these exposures.
And this morning we're joined by a very special guest, Dr. Shilpa Sayana, who is a board-certified physician specializing in internal medicine, obesity medicine, and functional medicine. Welcome.
Thank you so much for having me.
As the medical director of Sayana Medical and Wellness Center in Los Angeles, she's a leader in reversing childhood obesity, balancing hormones, and fortifying gut health through root cause, functional medicine approach. Dr. Sayana's expertise goes beyond symptom management. She works with families to address the hidden drivers of childhood health challenges, including environmental toxins, endocrine disruptors, and nutritional deficiencies. Her mission is to transform pediatric care by empowering parents with natural, evidence-based solutions that set the foundation for lifelong health. With training from Yale, UCLA, and the University of Vermont, she brings both clinical excellence and a deep commitment to preventative care for adults, children during their most critical years of development. Welcome.
Thank you.
So great to have you here. And Dr. Sayana, we're excited, and we know you practice functional medicine for all ages and stages. But we're going to get some really interesting insights from you in the world of endocrinology, which is really just hormone balance with a focus, as of course we do on the show, in children, and ways to perhaps most impactfully avoid the trend towards obesity from early days. So we can't wait to talk to you about more about that. Supporting hormonal balance at early ages and protecting our children from all sorts of dietary and environmental risk factors. But what we like to do on the show, as per usual, is open it up with Dr. Murray's what's going on and what's trending in the world as it pertains to this very sensitive topic. What do you have, Dr. Murray?
So, if we look just at the numbers, that tells the whole story. Obesity, 300% increase over the last 30 to 40 years. So just 20 years ago, 6% of the American children's population had obesity. So 1 in 15, 1 in 16. So in 30 years, we've gone to now 20%, 1 in 5.
Wow.
Huge. And a lot of people, when they look at that and think about it, automatically go to dietary. It's all dietary.
Right.
What's happened to the diet, which is true. It's a part of the processed food, low fat, carbohydrate, trend in America over the last 20, 30 years. But not everybody understands the importance and the impact of obesogens, meaning environmental factors that can actually trigger obesity, not only in childhood, but in utero, starting in utero. So that's what we're going to look at a lot more today. And, just to understand that we're surrounded, we cannot be affected by the environment. We're living in it. But what we can do is understand what we need to do to combat, neutralize, and detoxify what we're exposed to and what our children are exposed to.
Right.
This is a landmark study that really brought it home for me, 2005. It took 12 pregnant women from 12 different states in America, monitored them through pregnancy and at the moment of birth, took the umbilical cord blood from the baby and the mother, and screened it for over 5,000 different industrial toxins. The average found in each mother and baby in that umbilical cord blood, 285 different chemicals, toxins, heavy metals. So this sort of paints the picture of this is what's happening. This is what's happened. And if we're not aware of this or don't do something about it, then the chances are that our children can be impacted and affected by these at some point. And we know that all of these toxins, and particularly today when we talk about obesity, the plastics, the PCBs, the phthalates, they can disrupt the immune system, disrupt the brain, and the hormonal system, which is the link with the obesity.
Right.
So from that, we'll go into our expertise with Dr. Sayana.
Yeah. What brought you into functional medicine in the first place?
So I am an internist, so I actually see people 17 and up. And so as one of my first kind of love of medicine was internal medicine, and then I was traveling the globe teaching other physicians how to treat HIV and AIDS. And during that time, it was just a very busy time. I was wearing many, many hats. I was a mom, daughter to aging parents, had a small child, and my own health took a turn. And conventional medicine didn't have an answer. I actually had like a benign tumor in my neck. And that whole journey being on the other side of medicine as a patient was really eye-opening and very lonely. And it really opened my eyes to trying to figure out the why. Like, why does this even happen to me? I had no family history. And I remember going to my conventional colleagues and they were like, you know, do we need to cut it? Do we need to take a medication? And that was it. And then I realized there was something more. And that's what I then discovered functional medicine, which is really root cause medicine. Like, why is this happening in your life at this time? And what environmental situations set you up for it. And I'm so grateful to the whole body of functional medicine because it's changed my life, my family's life, and that of my patients.
What was it that you did? I mean, in functional medicine, as you just described, we're always about root cause.
Yeah.
Was it a whole transformation in your diet and your lifestyle? And
you know, in medical school, I think we only got 8 hours of nutrition training. So it was a lot about what are we eating, and food is really medicine. So what are you getting a whole food diet with real food that's anti-inflammatory, and actually just being mindful about sitting down and eating and being present with your food. So it really changed my relationship to food, and also looking at my hormones, mainly my stress hormone cortisol, because every month I'd be flying for 10 days to like Russia or to Uganda, South Africa, and also manage a full practice in LA. So it was a lot of stress. Sure. And that cortisol was impacting my body and causing a lot of inflammation. And I think a lot of people just don't realize that impact of that stress hormone.
don't we often think about this in sort of light of it being an adult condition, high stress, high cortisol? I mean, tell us a little bit about how this affects the pediatric community.
Yeah, and we were talking about it yesterday. You know, again, like we look at 1 in 5 children suffering from obesity. At the same time, 1 in 5 children now in America have some sort of stress, depression, or anxiety disorder. So it's happening across the board. It's affecting their mind, their brain, the immune system, and the hormonal system.
Right.
Absolutely.
And it's not just the mental, emotional, or what we, I guess, refer to as executive function. I'm stressed out, therefore cortisol's elevated. You just talked about the stress, very physical, hormonally disrupting stress of travel.
Yeah.
Just different time zones, just being on a plane, a metal can with pressure for 12, 14 hours at a time, let alone the emotional stress that you're dealing with these patients in Uganda and all over the world for, you know, AIDS and immune discrepancies. So, and you know, of the population of patients that you currently see, how much of that do you imagine is root cause, at least in part, stress?
I would say of my patient population, at least 60%.
Yeah.
And the just unawareness of even, and it's not just stress, it's also excitement. Like, I got a promotion. I'm like, oh no, she got a promotion. Like, that is cortisol that's going to be high. How are you processing that? And I think we just are so overscheduled and overstimulated that we just don't take time to breathe.
Right. You mentioned your personal story, and thanks for sharing that. But you also had one equally as close to home, literally to your heart, your own child, your daughter.
Yeah. So I was like working as a functional medicine doctor. I loved what I did, and I mainly saw adults. And I had a naturopath that worked with me, and she would show me these stool tests and these hormonal tests and these toxin tests. And I was like, "How old is this person?" She's like, "This one's 3, this one's 2, and have issues with autism or severe constipation." And I was like, "This is pretty crazy that there's this much inflammation that I'm not even seeing in my adult patients." And that really opened my eyes to all this begins so early. And at that time in my life, my older child, who's now 17, she was developing breast buds, and she was not even 8. And I went to her conventional pediatrician, and they said, "Oh, this is normal. This is what happens. You could get a period at 8.5 and 9, and that's normal." And I refused to believe that, and really looked into functional medicine for her. And what we discovered was she had a gluten sensitivity, but her root cause was she was exposed to mycotoxin, which is mold. And all of us were exposed to it. We didn't realize in her room by the air conditioning, there was water damage to the dry wall. And that was causing her mold. And the kind of mold she had in her urine was Zeldaron, which is a mold that mimics estrogen.
Yeah.
Wow.
Endocrine disruptor.
Yes.
Disrupt the hormones, early bud breasts.
Yes.
Yeah.
And thank God to functional medicine, because with that pathway, we were able to stop her precocious puberty, and she developed completely normally. And but her endocrinologist was like, we could give her Lupron, which is a medication that we give for people with ovarian cancer whose side effect is severe depression. Like, those are the tools we have in conventional medicine. We don't look for why.
Yeah.
Wow. So what did you do?
So we put her on a gluten-free diet, and we all went gluten-free. And more importantly, though, it was about nutrition. Are we nourishing her with enough fiber? And put on a very gentle mold detox. We got tested in our home, and that was an expensive bill in terms of just making sure that all the mold was gone.
Sure.
But it was invaluable for all our health.
A lot of people out there are becoming more and more aware about mold, mycotoxins, we call them, in their home. And you just mentioned, I mean, a single water damage.
Yeah.
In fact, I've learned if there's been ever water damage, it's not if you have mold, it's what kind and how much and how is it affecting you. It's a guarantee of mold. How do we test for these things?
Yeah, we can test for it in the urine just to kind of see what our total mold burden is and what kinds of mold spores we have. And I think really important to preface this is, what is your kind of genetic tendency to be exposed to mold?
Disposition to it.
Yes, and so I grew up in Southern Africa where there was no industry. Like, there was a very clean environment. I grew up in Botswana. But she has my genetics, and she's growing up in LA. So it's a very different environment. And so for her, we did a urine test, and we found out what kinds of mold she had. And then in the environment, you can check your own by yourself, or you can get a mold expert to come in and test.
Walk us through a couple of these off camera. We were talking about some of these solutions. So EnviroBiomics is one of the companies. ERMI, you mentioned?
So ERMI is a common test where patients are just curious, like, do I even have this? Or they're worried to tell their landlord, because the landlord might be upset or might not take them seriously. So an ERMI test is one you could do with a little brush, and you could do some dustings and send it to the lab and see places you suspect, like, could this really be mold?
And then this one is a blood test, right? You'd have to see your doctor about that.
Ideally, you want to see an integrative doctor or integrative pediatrician to test to see, is your body showing signs of mold toxicity?
Right. Immunoglobulins too, that means antibodies. Your body's recognized. The immune system has said, I've been heavily exposed to this particular mold, and then options for treatment. And then this one's a urine?
Yeah, this is a urine specimen, and it's looking for your total body's burden of mycotoxin.
Right.
And what's nice about this specific lab is they also have a matching environmental test, so you can see if the kind of mycotoxin showing up in your body is the same you were exposed to in your house.
Right.
Because a lot of times we don't know when that mold exposure happened. Was it at a different home, or was it at a different environment?
Right. And there are, diaper liner collectors, you can stick in a diaper for urine collection, right? I mean, that would make it really... What, as an internist, though, what are we looking for symptoms of mold exposure, other than, of course, maybe early breast buds at that age, but even in younger children?
I would say, looking for things such as anxiety, insomnia, tantrums, like mental health issues that can present as any kind of toxicity. And also also gaining weight unexpectedly. Like suddenly your kids gain 10 pounds in a matter of a couple months, and your diet hasn't changed.
Yep. No, I mean, in medicine, often referred to as the great masquerader, so capable of a whole swarm of symptoms that we don't always connect with, with mold.
Right.
And the other interesting thing for me when I learned it was that, not all members of the families, the same family, will be sensitive to that mold in the house. Typically, it's 1 in 4.
Right.
1 in 4 people. So you can have one person, a child in the house, be overwhelmed by this, and the other 3 apparently have no symptoms at all.
Exactly.
So, yeah, the detective work is critical.
And that comes back to the genetic predisposition you were talking about.
Yes, I remember the exact, the genetics load the gun, but it's really the environmental exposure that pulls the trigger. And I completely resonate with his clinical experience. It really is. And that's why I think people tend to discount it, because they're like, well, I'm not sick. Why are you sick?
Yep.
Right.
Yep.
Those words resonate very deeply with us. Good friend of ours, a friend of the show, an upcoming episode, Dr. Jeffrey Bland, father, granddaddy of functional genomics. Amazing. We've all learned from him. And to that end, as a part of your focus in infectious diseases, as an internist, we often think about bacteria, viruses, even yeast, but molds are often left out of the thought process of most physicians unless you're functionally trained.
So true. In conventional medicine, we think of mold as more like you're having allergies or sinus issues, and we treat we're so siloed in conventional medicine. It's the ear, nose, throat doctor, separate from the allergist, separate from the GI doctor. But these things are pervasive and they impact every organ system.
How many of your patients do you see with that you ultimately eventually diagnose as mold derived?
Looking back historically, because I've been doing this for about 30 years, I think I missed a lot in the beginning. In the last 10 years, I got more educated on it and have known to look what are the symptoms and signs to actually go down that pathway and test. So over the last 10 years, probably 10%.
Wow. That's pretty heavy.
Yeah.
And of course, the topic of the show today is obesogens, right? As you appropriately opened, and then your experience through your daughter, with her breast buds early on, 7 years old, with really minimal intervention. This could, if undiagnosed and or not addressed, it could have turned into an obesogenic response, meaning this could have caused her to gain weight, among other things, right? We thought we would share some visuals for folks and just go through them one by one. As an obesogen, what are we looking at here?
Just in terms of the bottle and the plastics and what are you sucking on?
Right, right. And at the end of the day, what makes plastic soft? And some people have already heard of this, but
Yes.
The softer the plastic, the more.
And so pervasive. It's like we need a huge culture shift.
Right. And just because something is BPA free doesn't mean the other plasticizers or softeners or other chemicals are harmless, correct?
Yeah, it is absolutely. I mean, we have to rely so much on parents being empowered and educated to look for those labels.
Right.
And it's unfortunate that that's the case.
So what's the alternative in your mind?
In terms of looking at labels and knowing what you're actually drinking from, I think with regard to plastics and trying to switch people to really trying to do glass bottles as much as you can.
Right, right. What would your mind say when looking at this? More of the same?
More of the same. I mean, the biggest thing is, is microwaving that. Imagine heating that. What are you really absorbing?
Or even freezing it, as I understand.
Yes.
Maybe even causative of, and when we're looking at, convenience, this screams convenience.
Right.
No one wants a stainless steel pan because you're scraping it off on the sink for
Exactly.
half an hour after. But what's happening with this when we're feeding our kids?
And because it's coming into that poor egg. And we're not using iron cast ceramic type clean clean pans to feed ourselves and our families. But it's convenient. Everybody's in a rush.
Right. I think that's really important, though, right? We hone in on the alternative, or let's call it the solution. So stickless pans out,
Right.
as you mentioned, ceramic or,
Iron cast.
Iron cast, because, and I love a good ribeye. It's one of my go-tos is a great big salad at night and a ribeye that I use kitchen scissors and I chop. But the trick is getting the pan really, really hot first, and then nothing seems to stick in cast iron.
No, cast iron is fantastic for cooking if you have patience.
Not to
That's
mention,
exactly it.
Right.
It's the
Right.
patience.
Right.
Yeah.
Not to mention, by the way, as an internist, you have a huge appreciation for what's happening in the red blood cell and anemia. And some people, just by using a cast
Yeah.
iron can actually solve their low level
Right.
anemias, right?
And
with
we
the
have
iron.
a lot of vegetarian vegan patients. It's a good thing to try.
Right.
Yeah.
What are we looking at here,
look
especially
at
as it
all
relates
these
to
cans.
baby formulas in cans?
Oh, that makes me so sad.
Right. So it's the liners, right?
Yeah.
These plastic liners. Just because something is tin or metal or whatever it is
Right.
on the outside doesn't mean that you're not getting exposed because of the lining on the
And that's
inside.
directly touching the food.
And a little bit,
Right.
I suppose, more of the same. Don't want to heat with that. That's
This
for sure.
one is tricky because, I mean, everybody's using it, but this is kind of the softer plastic that you can get, which means it has the highest level of those phthalates.
Right.
Yeah.
And, I pulled this one into conversation because, this looks like a really nice educational environment, a lot of light and everything, but this floor is actually not wood, it's vinyl. And what are your thoughts there?
Off-gassing pretty much forever.
Right.
Yeah.
It does look very kind of green and wooden and nature-esque, but yes.
But it's hidden. And by the way, I think part of the conversation has to be here that we're not trying to overwhelm or make people feel like they should be going crazy and change everything in their life. It's about burden.
Swaps, yeah. And what can
What
you
you
swap?
can
Yeah,
manage.
what can you manage?
Right, because often you can't change your environment, right? You can, manage what you put into your body, as you
Right.
said earlier on. That's number one, and then this. I mean, this is just very typical, right? Of a
Yeah.
playpen, 0 to 2.
Right.
All these plastics.
And
If
she-
you can go
yeah.
for wood,
Natural
Right.
fire. Yeah.
natural,
Exactly. And she's chewing
bamboo,
on it.
right? Well, she's chewing on that soft,
Right.
soft plastic. So again, drive this
Yeah.
home for us. The plastic, which is often phthalate to make it soft. What is an obesogen when we're talking an endocrine or hormone disruptor? Like, what? Visualize this for us. What's happening in the body?
So it's probably like setting her up to how she processes food in the future, how she stores fat, impacts her metabolism, and then will also impact her future estrogen and testosterone production. And these types of chemicals impact not only your propensity for obesity, but also how you process in the future puberty and what happens to your mental health.
Right. I'm going to oversimplify this. You guys are going to
Yes.
correct me on this, but if every cell in the body has these little receptors in it, and we're meant to lock and load essentially with the hormones that are meant to do things in the cell to make it divide or make it do things, that there are other things that might fit in that same receptor.
Right.
Those molds you were talking
Yeah.
about, these soft plastic softeners, and when you get those in there, sometimes they're even more potent, right, than the
Yes.
body makes on its own.
Yeah, and you nailed it. It's like those mimickers. Like these things are endocrine disruptors because they're mimicking what your body's used to seeing.
Right.
And they're just changing her trajectory and pathway in terms of how she should actually show up. Her epigenetics are changing because
term.
of these exposures.
That's the term right there, epigenetics. Let's unpack that for a second, because people understand genes, the eye color we have, and hair color we have, and skin color, everything else. That's what we call phenotypic. But what is
Epigenetics. Epi really, I think, is what medicine is all about in this day and age. We now know that the environment is affecting us more than the genes we were born with.
Exactly.
They're important, what we were born with, in terms of susceptibility, but the world, what we eat, what we think, what we drink, all of those things are actually affecting our genes and determining how they're going to display their message. Biggest study ever done that I've found on epigenetics, 2016, I think, European Journal of Aging. 400 million individuals through genotyping. The result was that 93% of their health and longevity was due to the environment, not their genes.
I believe it.
93%.
Right.
Yeah. So at best, maybe 10, 20% is our genes. But really on evidence like that, how we're living, what we're doing, what we're eating, what we're thinking, what we're drinking
Exactly.
is determining the outcome.
Absolutely. Very, very well said, both of you. We have this. We like to look at this consensus meter. This is a review of the scientific literature. When you ask this AI, very heavily evidence-based database, a question. So what I just asked it was, do plastics cause endocrine disruption? This isn't. born of natural, alternative, or functional medicine. This is just science.
Right.
And so the consensus meter is a heavy 88% from the data. But what I think is the most striking is, okay, there's some studies out there that are not necessarily definitive, but there is zero no. It's either maybe or definitely. And the majority is saying, I think we're pretty firm here that's definite. So we've got other things. So we've got, shower curtains made of this stuff, right? We've got...
You can smell the shower curtains. If you ever get a new one.
Yeah, you can.
Yeah.
You know what I've heard you say before, if you can smell something very heavily, like, even, perfume,
Yes.
that it's already
in your brain.
Right.
As soon as you smell it, it's in your brain.
Yeah.
That's right.
What are these things doing in terms of
Yes.
endocrine disruption or hormone dysregulation?
Yeah. Household cleaning products, and people just are unaware as to, especially in your as a baby, when they're mom's rushing up to clean up that spill, and baby touches a toy that touched that and is directly exposed. And these are, and again, endocrine disruptors. How are they impacting your cortisol and your insulin? What's it setting you up in the future in terms of how you metabolize?
Wow. I mean, in our home, my wife is amazing with this, and I've taken her lead. I mean, we use baking soda and water as an abrasive for some of the porcelain or marble countertops. We use essential oils in
Vinegar is another great
vinegar,
one.
water and vinegar to mop.
Right.
Yeah.
I mean, these are all simple alternatives that people can go to. In fact, they're a lot cheaper most of the time, and big industry. We have to always be critical and mind and critically thinking when it's walking down the aisle in a typical grocery store. I'm not sensitive. I'm not one of those people, but I can't stand this aisle. I will avoid it at all costs. I just get a headache.
Right. Yeah, and I think there was a study, I don't remember when it was from, but it was about using dishwashers versus hand washing. And the families who used dishwashers were more susceptible to like asthma. And it was just like everything is super clean. And what's the products that they're using versus dishwashing? So we use dishwashing at home. Everybody gets annoyed because it's a little longer and it's a little inconvenient. But the price of convenience is our health.
Right. Yeah. Absolutely. I'm looking that up to see if I can find that. It was asthma.
Yeah, and dishwashing, like the allergies and asthma in terms of dishwashing versus hand washing. Not that you should go to hand washing because it is inconvenient, but again, it's about what can you do that are easy swaps.
Right. Yeah, here's one at least that was published in 2015 in Pediatrics, Allergies in Children in Hand versus Machine Dishwashing. That might be what you're referring to, or the results. Essentially, in families who use hand washing, allergic diseases were less common than in children whose families use machine dishwashing.
And we're speaking to parents who are really busy and asking them to hand wash might be a lot, but these are small little lifestyle hacks that you can make that could have impact, especially if your child already has a bunch of allergies.
Right. And this always looks natural, and this is how we're promoted, and it's in the commercials, and it looks beautiful, but it's terrible for you.
Completely.
And again, not to do shock and awe stuff. We don't like to do that. We just like to inform people. Flame retardants, which are also in drapery and couches and so forth. Just, I guess the solution is look for as natural as you can. There's bamboo, there's cotton. That
I think it brings up another point too, that we haven't touched on yet, that knowing that we're all exposed to these things, which is impossible to avoid, then what does our body have as a detox defense mechanism, which we have, surprisingly, because we're over 100,000 years old, but we have all the equipment in our body if we give the right nutrients to help detoxify these. Yeah. So for children, my number one is always just vitamin C. Has the capacity to detox so many things and very easy to give.
Absolutely.
Yeah.
The Environmental Working Group, which I know you're very familiar with, and some of their subsidiaries, Skin Deep and so forth, they put together all kinds of great lists for people at home to know that they can check this out. EWG.org. Is your home healthy? You can literally walk through the home. And then this one here is a little checklist on, as we were just talking about, cleaning products and what the criteria is for getting stuff that's a lot less toxic, in the home. But skincare, hair care, makeup, sun care, they do lists for all of these things. And it's just a wonderful database.
That's great.
To cross-reference. And the list is long because, this is not just what's in the environment, as you, again, spoke to earlier. It's what we're putting in our kids' diet. Talk to us a little bit about what we're looking at here.
I mean, this is all like just artificial sweeteners and sugar. And that whole concept of sugar, I think it's so important to empower your kids as they get a little older to involve them in meal prep and what kinds of foods they want to take for lunch.
Right.
Is this good for your body? Did you feel better after eating it? As opposed to just saying, this is what you have to do, or be very restrictive.
Right. And like them or love them or hate them. RFK Jr. has put some interesting policies in place and moved some, into a new health policy, one of which, of course, and I'm from Toronto, Canada. That's where I live and practice, and we don't have the same colorants in our foods as you guys do, and nor does the European Union.
Half the world
Right.
never allowed these to be put in the food.
Right.
And the main one being the EU, the European Union.
Yeah.
So all food colorings never allowed in Europe.
Right.
And yet here we just,
much.
until now, starting to look at take them out.
And we ask why we're like the sickest nation and why we spend so much money on healthcare. And it's everyday intake.
Right. And so it's not just sugar
No.
or empty carbohydrates or let's say mineral nutrient devoid foods. It's these colors that are causing hormone
And
disruption.
marketed directly to kids. It
Right.
looks beautiful and colorful.
Right. And we can't forget about the 4 screens. Why would this be an obesogen?
Yeah, in terms of just exposure to EMF and also just in terms of the attention span, like kids just being on TVs or being on iPads and sitting and not moving.
Right. Yeah, that's the thing, right? If you're
And the blue
and
light,
it's starting earlier and
And
earlier.
the blue light.
Yeah,
Yes.
the blue light. 2, 3, 4 years old. They should be spending maximum. What's your advice? 20, 30 minutes a day? I mean, no one's going to do no minutes.
Max.
But I've even heard, I've seen some studies that show 0 to 2, you shouldn't be showing them anything.
Yeah, you shouldn't.
Yeah.
But who isn't? Parents, convenience. Let's just put them from the iPad. And then if they're not moving, are they sweating? Like that's a great way of detoxifying.
Right.
So if
One
you're
of the
just
best ways
sitting
for certain things,
yeah.
right?
So if you're not moving, you're just again, it's confounding everything and impacting it, making it worse.
And you mentioned, I think the key term, convenience, right? And a lot of parents are going to these for,
Lunchables.
the early school years, 5, 6, 7, another sort of
Right.
cohort we talk about on the program a lot about. And this is not food.
No.
What's in this?
Right.
I don't know.
Preservatives, plastics.
Right.
Yes. And
It's
it
very
again
sad.
looks pretty.
You talked about blue light, and earlier in the show you mentioned, early days when you started to suffer from health issues yourself, you were doing a lot of traveling. Talk to us a little bit about the connection between, circadian rhythm or day-night cycling, blue light, and how all of that really is disrupting, especially children's hormones early on.
Right. And I think, lots of times parents are putting their kids in front of the iPad to fall asleep, like here's a bedtime story, and without turning on the blue light. The problem is you shouldn't have exposure to blue light at least for 2-3 hours before bedtime because it stimulates it impacts your melatonin in terms of how you actually fall asleep and can stay sleeping. So or you could wear blue light glasses. That's an easy kind of fix. Or every phone allows, or every device allows you to block your blue light. But it's really important in how it impacts melatonin and cortisol, so that you actually can get restful sleep.
Yep.
Huge.
And what's the greatest supplement for the immune system?
Sleep.
Good sleep.
Yes.
Right.
Yes.
That's it.
Right, which is bringing down cortisol. Cortisol has its own, and I think you were alluding to this earlier. Cortisol has its own peaks and troughs throughout the day, and
Correct.
not all stress is bad stress. And stress comes from a number of different places. But this sort of high in the morning, tapering down and weaning down into that. I think what we're saying here is that you don't want to re-stimulate that late at night. And this is one of those things that does that, right?
Exactly, it does. And in the younger adults I'm seeing, a lot of them say they were just bad sleepers as kids, and it started from then. And they just think it's well, my mom's a bad sleeper, so I'm a bad sleeper. This isn't genetic.
Right.
This is how are you programmed by your environment.
Right.
And what were you allowed to do between 0 to 7 that could have radically changed your sleep quality and how you age.
Epigenetics.
Yes.
And we'd be remiss if we didn't talk quickly about gamification of everything. But even the standard, games that exist, video games and so forth, not only as an obesogen as it relates to not moving, otherwise playing your own games outdoors,
Yeah.
but again, it's more of that bad light exposure, maybe EMF exposure, and it's stress.
And
Plus
stress.
brain function. I mean,
Yeah.
Right.
what are you responding to?
Right. Your next
Your
dopamine
attention.
hit, right? Yeah. Tell us a little bit about that. We're hearing more and more, parents are hearing more and more about, neurotransmitter dysfunction because of the exposure to these 4 screens and games. Everything is a screen and game. What are we talking about when we're, or what we hear about anyways, is this reward, and how is that impacting health overall?
And some of us are just genetically pre-programmed to kind of be all or nothing type people. And so when you expose a young child to things like games that each time is a dopamine hit where you're like, I need more, I need more. It could also be in foods, but especially in things like games where you have to constantly just be on. And after a certain point, your dopamine receptors are saturated and you need more and you need more. And then it's hard to reverse that.
Interesting. The epigenetic change. This is a perfect example. Again, correct me if I'm wrong, but the more you're exposed to the dopamine hit, depending on how your genetics work in the first place, the more that you're ultimately seeking that out, the more you're saturating your cells with these receptors, harder it is to get the hit. But then you're probably more likely to be seeking out other rewards, like you said, beyond the game. So
Correct.
sugary foods,
Exactly.
other addictive properties, maybe drugs later on in life.
Exactly. You're really setting your child up in these formative years in
Right.
terms of and being bored is okay.
Right.
Like my son the other day was saying, I'm
Right.
really bored. I'm like, that's good.
It's good.
Yeah.
It's okay.
It's
Do
hard.
that. I remember a nap time. Very distinctly remember a nap time. Probably until I was about 5 or 6. But nonetheless, I hated it because I've never napped. My son never nap. The way I know my son is sick is if he naps during the day or used to nap. Right. My daughter, the opposite. She can sleep anytime. But I'm of that variety. Never been able to nap. And I remember my mother saying, I would complain and really whine about this, hour alone time. Really, it was for her. A lot of it was like so she could rest. Right. So 3 kids, single mom. But sent me to my room nonetheless. You go to your room, I don't care how bored you are. And you know what? I just lived in my mind in that hour. I read a book. It was so healthy, I think, for that formation of imagination. Right? Kids don't get to imagine anymore. And it's really sad.
This is the time also to remind us, that brain growth is all occurring in the first 7 years. So by the age of 7, 95% the size of the adult brain.
Right.
So those are the formative years. That's when everything is programmed, the foundation is laid. What happens in those first 7 years, what stimulus is given and what isn't given, is going to determine how that operates for the rest of their life.
Yeah, that metabolic programming is happening then in terms of your relationship with foods, your immune system, your hormones, how you deal with toxins. So it's such a critical period.
Yeah.
Well, and an interesting sort of, tie together here is that the brain is the control center. Most people think hormone disruption, obesity, just like it's from here down. It's not. It really starts here, which controls everything else. And we all appreciate the work of Dan Buttner and the Blue Zones, and we've seen his work. And some of what he describes is the link to obesity is how modern infrastructure is being formed more and more. Suburbia is being formed, and what we're looking at here, of course, are a lot of roads in and outs of garages, cars, but there's no option to bike ride here or walk. And that's really sad. This is, where's the playground in this community? Where's the baseball diamond? Where are the sidewalks? So there's no real help from outside or government level in. So we're fighting that as well. So outdoor time. What's the importance of outdoor and sun exposure and?
It's super critical in terms of vitamin D levels. A lot of our patients, in obesity medicine, my obesity medicine training, a lot of it was emphasis on vitamin D. If you don't have enough vitamin D, you're more likely to be overweight, obese. So getting sun exposure, walking, being active, having green space, being in the nature is the best way to lower your cortisol. So not having that in your structure outside is already a disadvantage. So you have to seek it out.
Right. I would love to segue to the gut because, we talked the brain, we talked about hormones and endocrine system, and, you alluded to it earlier as well. The importance of the microbiome and the diversity through, let's start with sort of 0 to 2, even in utero. We talked a little bit of exposure to mom, but breastfeeding, the importance of that and the gut microbiome, and of course, colostrum. We hear you talk about that. You're passionate about that for a good reason. Sets the stage.
Okay. Well, the stage was set 2,500 years ago by Hippocrates, who said all diseases begin in the gut. That's 2,500 years. It's taken this long for functional medicine to go full circle back to this point.
Yeah.
But really, any sort of evaluation, in my experience, especially with children, anything that's going on starts with looking at the microbiome, doing a comprehensive digestive stool analysis. That's the foundation.
Right.
And then we can look out from there and
Exactly.
see. And then we understand the importance of the microbiome in the brain, even more intimately related than we ever thought.
Right.
So we have the gut, we have the brain,
Yeah.
basically directing everything
Yeah.
or affecting everything.
Right.
So, yeah, in children, critical, and I'm sure adolescents and adults too. Yeah.
Absolutely. I think so much of America, especially young kids, are constipated. Like we just don't, the idea of having a bowel movement daily is just not something that we've given attention to. And when I see adult patients, like, oh, I've been like this since I was 5, I think. I've always had a tummy pain and it was okay and it was accepted. But if you can't have a bowel movement, how are you going to detoxify?
Right.
How are you going to get rid of these toxins? And, if you are breastfeeding for sure, but if you can't breastfeed, at least having formula that has prebiotics, probiotics, something in there to support the gut. Because the gut microbiome and the integrity of the gut lining is so critical in terms of metabolism, risk for later obesity, and how you process these nutrients.
What is that connection? Obesity and the microbiome. What do we think?
So if you have the wrong bacteria in your gut, either because you're chronically stressed, you're not nourishing yourself, or you have toxin exposure, you are going to cause dysbiosis or the overgrowth of the wrong bacteria, be it bacteria or yeast. And that bacteria and that overgrowth causes inflammation. So you're setting up your body to have this inflammatory canvas that's going to take your calories and convert it to fat instead of actually burn it. And so it's so important to have a good gut lining that has good integrity, and also really feed your bacteria, the good bacteria, so they can overpower the bad guys.
Right. This reminds me. I think we talked to Dr. Bill Sears and Dr. Michael Murray about this, and this started back. I don't know, maybe 15 years ago. These original rat studies. Just link that to for visual for folks.
Sure. Same rat, same genealogy, different diet, and different outcome.
Right.
Simple. It's so simple.
Like these are like identical in gene, but this one here had a messed up microbiome. Got obese, and this one here is healthy size and weight. I mean, this does translate into the human physiology.
Completely. Completely.
In functional medicine, there are a lot of ways to test. If parents think maybe digestive issues are at play, most of us are familiar with the GI effects, stool test, and or the GI mapping through diagnostic solutions. Why is it important for parents to even maybe ask for these by name from their doctor?
And it's important, and you need to actually ask from somebody who knows how to interpret it. Because sometimes some people have brought in these tests and they're like, oh, my conventional doctor ordered them and said everything was normal. So it's important to have some experience in terms of how to interpret it. And going back to that previous picture of those mice, it's really the hormones there that are completely impacting them are insulin and leptin. Like these hormones that are going to make you store your fat. And if your gut is inflamed, and these kind of tests can show what exactly is your microbiome. Do you have an overgrowth of excessive bacteria that shouldn't be there? Or do you have things like parasites? Do you have enough digestive enzyme that's able to digest your foods properly, especially fats? And do you have enough prebiotics to actually feed the good bacteria?
That might even be the more headline news of the day. Probiotics have been talked about for some time. Of course, there's no best probiotic. There's only the probiotic that's going to confer health benefit, right?
Exactly.
But the the fiber that feed them.
Right.
I mean, that's a huge story. How deficient are we, or kids in particular, in fiber?
Super. And I think it also, in terms of parents knowing what fiber is. Like a lot of times patients are like, oh, I eat so much fiber and I have a huge salad a day. But like a bowl of arugula has 0.2 grams versus a bowl of raspberries have 8 grams. So that's a great thing to give your kids. Raspberries, avocado, beans. And our recommendation is to at least get 20 to 60 grams of fiber if you can in your diet, but it's important to know where fiber exists. And why fiber is so important is because it feeds the good bacteria. It also helps you bind toxins, helps you with constipation. But we are a nation that lacks fiber.
Legumes.
Yes.
Huge source.
Beans, legumes. Beans, good for the heart. The more you eat, the more you toot. The more you toot, the better you feel. Sweet beans with every meal. Tell us the difference between soluble, insoluble, and how that affects the microbiome. It's a really important topic for parents to understand.
I mean, think of the whole prebiotics as the soil in the intestine, in the inside of the intestines, that's actually creating the environment or the ecosystem for everything else that's in there.
Right.
And that's where we need soluble, we need insoluble fiber. If we want to have good soil, you need both. Then the good bacteria that can actually thrive and live get what they need, and at the same time they're keeping out the bad guys. So without that strata, without that substrata of soil, the prebiotics, the fiber, everything else is struggling to live and do its job properly.
Right.
Yeah. So.
And then we have this whole new sort of burgeoning area in science that is something you would interpret as an internist functional medicine expert on something like a GI map or a GI effects test through stool, and that is postbiotic. Tell us a little bit about that and why that's important in overall health.
Yeah, and a postbiotic, as you have, there was a huge kind of move toward everybody needs to be on a probiotic. And so you're on a prebiotic to feed your good bacteria, and then you're on a probiotic to maybe replace the bacteria, especially if you've done a GI-FX or a GI map and have taken some herbs to kill off the bad bacteria. And then you need postbiotics to actually process all these nutrients and make sure that your gut lining is healing. And a lot of times, patients are taking so many supplements, or kids are taking probiotics, but they really use food as a source for prebiotics and probiotics. So it's important to think about what can you get from food.
Right. Huge. And introduce these some fermentable foods early on, right?
This is where fermentable and pickled foods come into the whole, and why so many countries have a longevity history of different fermented foods. If you look at around the world, you know, this has been like what we've used for aeons.
Right.
Yeah.
And we've talked about this on the show in the past as well. Just a great resource, proudly Canadian, probioticchart.ca. But within the pediatric health section, what this does is fragment the probiotic strain species. And it'll give you not only the brand name and of course, what's in it.
Right.
These are the species, but then it'll also give the references of the studies done to support the claim of what it's for. So not all probiotics are good for colic, but these baby drops here are because of the Bifidobacterium longum, or we scroll down and BioGaia. That you've heard of this before, the Lactobacillus reuteri. That's a strain species that we know, and you mentioned constipation can maybe aid in constipation. But there are other probiotics that are good for, mental, emotional, atopic dermatitis. It's all about the strain.
But also just important to mention here, you see how many are important or, suggested for post-antibiotic use as well.
Yeah.
How's that affecting obesity at large, especially in children?
Yeah, no, the antibiotic use is just so prevalent. If you've had antibiotics before 6 months, antibiotics before 2 years or 5 years, you are 3 times more risk to have issues with ADD, mental health issues, have risk with processing your carbohydrates, have risk of being overweight or obese. So critical to see, do you really need these antibiotics, and asking your physician, what else could you try in place, and is it really time for that? And are you doing things daily to boost your immune system?
Right. And I've heard you talk about this before, this vicious cycle, unfortunately, of children born into the world. Sometimes you can't help it. You have to have a C-section, but the incidence is so high. And then they're also not breastfed. And then they're also complicated with ENT issues, for which then they take antibiotics. And it's just a constant...
It's a setup. It's really a setup,
Yeah.
I mean, obviously, the birth, when possible, vaginal birth helps start that microbiome ticking independently. So if we miss that, that's one sort of measure that's been missed. Not breastfeeding. There are really good formulas out there where you can add, the colostrum to them, get the fatty acids. So there's ways to correct it. We just need to be aware that if a child misses some of these milestones, what can we do? What can we give to make up for what was missed? Yeah.
Absolutely.
Yeah. And antibiotic usage is so prevalent, especially in these young formative ages.
Right. And I think you nailed it. You just, basically, if that's the only solution given, think twice, because there's probably some others. And sometimes we have to resort to antibiotics. I mean, there's just there's just no choice in some instances. But there are many other, let's even not call them alternatives. There are many other first-line therapies that are easily as effective or maybe more, that use the body's own innate ability to fight off infections. What are some of your favorite, by the way, your go-tos for immune boosting? Because again, getting all this right in the early days, it correlates to obesity so strongly, because if you're resorting to antibiotics and you get that, the chronic reinfection, you disrupt your microbiome, you're epigenetically setting the stage for over.
You really are.
So, I mean, we'll start from, do the ABCs. So, first of all, being proactive, preventative, rather than waiting until there's an infection is always, the most critical thing. Yeah. So for that sort of preventative action, keeping the immune system strong in a child, number one, a good multivitamin mineral that has all the essential vitamins and minerals. Number two, extra vitamin C, vitamin C for the immune system and for helping detox the environment. And then vitamin D. That's it. So if you're doing that ongoing, already your child's immune system is going to be equipped better to deal with whatever comes along and it encounters. Completely. At the time, if something does come along, then, we look at the botanicals, we look at other things that can actually have an effect too. But for me, proactive is,
Exactly. Yeah. And you have to especially flu season, especially with COVID, a lot of kids haven't been exposed to infections and their immune system is more vulnerable. But being proactive and preventative.
Okay, so let's talk about that. I mean, let's just frame it up as eat dirt. Why? Why expose to... What is this about immunity training that's important?
I think, the one thing, I can't reference an article directly for this, but people who are growing up in, I think Africa was where the study showed, had very much thicker intestinal barrier lining because they've been exposed to parasites and bacteria. So their body has greater resilience. Versus our gut lining is very fragile. We live in very sterile environments. And so if it's very fragile, that means instead of being nice and tight, it's very permeable. So you can be very sensitive to foods you eat repeatedly. So being exposed to some infections and dirt and bacteria is a good thing in moderation.
Exercise.
Yes.
It's exercise for the immune system.
Exactly.
Yeah. And just with the vitamin C, classic example for me is a lot of the studies, like if we could probably look at it, Bryce, but the studies on vitamin C, not all of them show that it's helpful to fight an infection or when a child gets sick. But what the studies do show is that the preloading, if they've been taking vitamin C prior and ongoing before they get an infection, then it's effective in reducing the severity and the duration. So it's that whole idea of what we're doing. And it's creating those rituals, like with your kids. Like, are you taking your supplements?
Why are you taking them? Educating them as to why. Same thing with food. What are we eating today that's good for our body?
The consensus of does vitamin C improve immune function in children, or vitamin C supplementation in children, at least as the visual scale goes, is pretty strong in favor. This is a possibility chart. That doesn't mean it's not no, but there's very, very little room for, mixed or no. So, and I think it's in context, right? It's context. So, like you said, just throwing a mega dose of vitamin C at a child that is already, down with a cold or a flu, it may not necessarily, but having it in advance, so these natural killer cells are working on guard consistently. I think that's true and that's important. I also just happened to, while you guys were talking, ask it this question here. Does diet influence generally the development of a healthy immune system in children?
Oh, look at that.
Another zero, no scientific evidence would ever say no. I don't really know what the possibly is, but of course it does. And how? Some of them we were talking about, probiotics found in food, breast milk, micronutrients, etc. So the jury has long been out on diet influence on immune system. How about hydration? How important is that? And are we doing it the right way?
And hydration, I think, is so critical for just obesity and metabolism. And are we getting enough electrolytes from our food? Our soil is so depleted. Things like magnesium and other electrolytes, are we actually getting enough so we can keep our fluid intake more intracellularly as opposed to extracellularly. And I do think a lot of people are walking around severely dehydrated.
Children in particular, right? And then they have chapped lips and their skin is dry, and they're maybe not even paying attention because how can they if they're underhydrated? I've heard you say, I think I've heard you say this before, that it was a cute way to describe it to a child. Do you want your cells looking like raisins or grapes? You want grapes, juicy grapes for cells, and you can't do that without drinking enough water.
The other image I like to use, the Earth, if we look at the Earth is 75, 80%
Yes.
ocean, water, lakes, rivers. And the human body is almost exactly the same ratio. So 75, 80% water, what's our most important nutrient? It has to be water.
Right.
Yeah. And then it comes to the right kind of water, also really critical. So for me these days, the only one, really I'd recommend is reverse osmosis as the only filtration method that eliminates every toxin, including radiation.
I completely second that, because we see in our patients a lot of arsenic exposure, and we have these acceptable low levels. But they're not. Should any arsenic be acceptable? And reverse osmosis completely does eradicate that. You see that in like India and Bangladesh, but we don't use that enough here. And it's easy. You can get these portable filters. It doesn't have to be complicated.
You can
They
get a
go under the
countertop
sink.
one.
Yeah. But reverse osmosis.
What is it? I mean, it's at the end of the day, it's taking city water, which may be quote unquote safe, but not clean or pure, and pushing it through a membrane or a multiple stage membrane so that on the other side, like you said, nothing. Except pure H2O is there.
Exactly.
And I have a saying with my patients I often use as well, and that is, if you don't want to be the filter, then you must use a filter.
It's a good one.
Our bodies do some good job filtering, but you don't want the remnants, because these heavy metals you talk about, they store up in fat and brain
They
tissue.
do. And they completely impact that gut lining we were talking about. There's like they damage it.
Right.
Yeah.
And these kits, these things, you don't need them necessarily on your whole home.
No.
This isn't a burden of an expense for a lot of
drinking
people.
drinking water, and cooking.
Yes.
Obviously.
You want
Right.
to use it.
What do they range? I mean,
I mean, we have one in our house. I think it was like $500. You got it on Amazon. You could stick it underneath the sink.
Yeah.
It's called Ion or Water Drop.
Okay.
But there are multiple of them.
No, you can go from 500 to 5,000,
Yes.
depending on what you want.
Totally.
But really,
completely.
the 500 one will do the job.
Yeah. And then air filters is another one to consider, just in terms
Right.
of your home. We have one that's a little loud, but you can get silent ones, but that it can clean mold, especially if you live near a highway or an airport.
HEPA filters.
Yes.
Well, that's right. That's the point, especially where you're sleeping or your
Yeah.
child is sleeping. 8, hopefully 12 hours a day for most children, but 7 to 8, who knows?
Right.
You know,
I'm happy with 9 for
the
my
parent.
14-year-old.
Yeah, that would be amazing.
But point is in that environment where they're
Yes.
spending time sleeping, hopefully, encouraging their brain to grow. You want to just pull from the air, not just allergens, but like you said, dust comes a lot of time with these heavy metal.
Correct. Mold,
mold,
mycotoxins,
right?
and HEPA filters are one to do.
This was the water drop you were talking
Yeah.
about. So these systems easily installed. And again, I think we have a lot of slogans on the show, but one of them that we always come back to is your health is an investment, never an expense. Some can't afford some of these luxuries, I would call them, but most of us probably can, and if you can, you absolutely should, because you're investing in your child's future.
And then the same thing like with food in terms of eating organic. Like, can you eat organic as much as you can? Start slow. Maybe it's not an avocado, but maybe at least the berries, which have high
Which
fiber.
are the most important, in your opinion? Which
Things
are
that are actually going to touch the pesticide. So if they have a hard covering over it, maybe you don't have to get organic, but look for things that if there was pesticide sprayed on it, you'll be actually eating it, like berries, apples, things you're going to eat the skin off. So this way it doesn't have to be so unaffordable.
Yeah. What's our number one? Strawberries.
Yeah.
Yeah. 90 different pesticides.
Yes. And they're delicious, but get them organic. And,
Yeah. That's a,
Yeah.
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 We brought this up already, the Environmental Working Group. This is a free guide. You can get the Dirty Dozen. You can get the Clean 15. And some of them you already mentioned on here. What do we have? Number 1, you said strawberries. You're obviously right, Doc. Then you've got spinach, kale, Peaches, grapes, pears, nectarines, apples. These are some of the worst. And there's, of course, many, many in between. But this is the dirty dozen. And so I guess part of the point here is within the clean 15 and some others, like you mentioned, avocado. You were also right, Doc.
Great food.
These aren't as important to spend that extra few dollars on organic. You know, you can get away with the standard. I think also, this is part of our regular rhetoric on the show as well, and that is eat a rainbow.
Right.
Start there,
Yeah.
and then hopefully with the dirty dozen, make it organic, but eat a rainbow of fruits and vegetables every single day. At least I've heard you say half a cup is a serving, and make sure you're getting red, orange, yellow, green, blue, and purple of all the fruits, and the same with all the veggies. And it's a salad, a soup, and a smoothie every day, and you're probably covering all of those.
Yeah, you probably are.
You know, dose recommendations anyway.
And then just add the protein.
Right.
Yes, exactly.
Yeah.
And you know, with I know we're talking about food, but the other things is skincare products. I mean, places like Sephora in the mall, you see this whole generation of like 4-year-olds, 5-year-olds getting skincare products. That's very concerning in terms of if they're applying them regularly onto their
to the
skin, and
skin.
the skin is your biggest organ. That's super concerning. Are they getting actually? I doubt many of them are wholesome.
And yet another EWG free guide for everyone to look at, you know, with over 127,000 products, over 6,000 brands. And, you know, you can put it so, you know, I don't know, what's a common product, you know, that parents are maybe using for their children? Sunscreen. Okay, so let's put in sunscreen. There's probably a million different brands. But, you know, these are obesogenic for a lot of reasons, right? What we'll do is we'll pull up one example. Let's pull up this Attitude Sunly 30 SPF, and EWG will rank it based on best to worst. They want me to sign up, but I'm not going to right now. And this, of course, is the ranking you want to get. Very few products are, and you want to ditch anything that's in this red or even a high sort of medium range up here. So it'll do it based on what endocrine disruption, immunological toxicity or carcinogenicity, right? So, and it goes through each individual. So here's what we want, right? We want zinc oxide or titanium dioxide. They're physical blockers, and not the anything oxybenzone or
bad for the environment.
Yeah, petroleum-based.
Petroleum-based, right? Right. So this is all about understanding the scores here. You can pick this apart. I didn't even know that they had this, but eventually, if you get a really great ranking, you can go right to Amazon.
Wow.
Buy now. There you go. That's smart of them.
And it is an app, right, where you could just put this stuff in and just as you're shopping around.
Right. So very few product concerns on this guy. You know, we just happen to be lucky to pick that one. But there are a lot that get ranked, you know, very toxic.
That are heavily marketed to kids.
Right. Exactly. So it's another free one, folks. Get busy online and make sure you know what you're putting on your kids. Skin is the largest organ of the body, right?
It is, and it's absorbing all of this. You know, the one thing we talked about briefly was sugar, and coming back to, and it was maybe something parents can use that might be a bit complex, but in obesity medicine, studying for the boards, this concept of teaspoons of sugar in your body. Like we only have 1 teaspoon of sugar floating around in our body at any time before an insulin spikes. And so our goal, what I tell my adult patients is in your intake, don't have more than 10 teaspoons of sugar a day. And what does that mean? It's an equation, but it's not a complex equation. It's the total carbohydrates minus your fiber divided by 5. So based on that, if you had like a banana, it could have 6 teaspoons of sugar. Or if you had all the yummy fruits, the mangoes, the papayas have a lot of sugar. But if you did apples and berries, there's not much sugar because of the amount of fiber. So that hack in that equation is fiber. And it's something like as you go to the grocery store, especially those foods that are touted as super healthy for you, really just apply that equation and say, okay, how much sugar does this one bar have? If it has 7 teaspoons of sugar, don't eat it.
Right?
Yeah.
That's a great equation.
Yeah, and it's simple. And
that.
my son knows it, who's 10, and he's like, oh, this one has a lot of sugar. I'm not going to eat it. And it's nice that he's like learning from that. It's just it's not good for your body.
Insulin, especially in children, that's like the forgotten about hormone. Most people think hormones, they think sex steroidal hormones, but insulin, I know your special focus as an internist and endocrine specialist in functional medicine has to be insulin because our sad standard American diets throw it off so heavily. And sugar, of course, is the major white evil. We get so many questions on the show, from viewers and followers. You have time just to answer a few before we start to wrap up? The time's flying here. We're like over an hour and not realizing it, having fun. You want to lead us off, Doc, with some questions from viewers?
Actually, I think, let me just find, you start while I find
I've got one here from an Instagram viewer, Clean Living Mama, who's asking, I've heard that every household product, I'm not sure every day. I've heard everyday household products can disrupt hormone balance and even lead to weight gain in children. What are the most harmful toxins I should be aware of? And how can I safely eliminate them from my home? Well, Clean Living Mama, you know what? The whole show has been focused on this, so you'll have to watch back. But what were some simple top-line recommendations there?
I would say, going back to your baking soda and water, trying to use basic things. Branch Basics is a company we use, which is just simple, clean ingredients. And it's, again, using very natural things that are not heavily processed in terms of chemicals. So I'd say using simple ingredients is a great one. It's an easy one, and what's nice, it's a refillable container, so you can just send it and get your stuff refilled.
Perfect. Yeah. So I mean, look, these are things you can probably DIY, but if you're not into that, they're packaged and they're all natural by the look of it.
Yeah.
What's Oxygen Boost? I'm not sure what that is. No chlorine or bleach, no dyes.
And those are the things. You don't want chlorine, bleach, fragrances, things that are very smelly with your household products. I would avoid.
All right. What else do we have?
I mean, this is exactly your question.
Okay.
This is from Facebook. I'm hearing a lot about early puberty linked to environmental toxins. What are the early warning signs, and are there steps we can take to prevent this in our kids?
Absolutely. I think the first thing is just being aware that 7 and 8 years old it's not normal. Just because it happens, it doesn't mean this is normal. But things you can take is making sure your child is getting enough fiber to really bind all these toxins and excrete them. And if you are noticing these early signs of excessive weight gain, of early breast buds, or deepening voice, all this is happening before the age of 10, investigate. Look, and the simple things we mentioned on the show, which is the filters, water, air, put those in place, but test. How do you know if you can't test? And you don't have to use blood, urine, stool, easy things, saliva, exactly. But test. Don't be blind as to what could it be.
Great.
That's excellent. We've got another question from YouTube. Modern parenting, how important is gut health in preventing childhood obesity? And of course, are there specific probiotics, we talked a lot about this, or dietary changes that you'd recommend specifically in young children?
Yeah, I would say the biggest thing is, gut health is critical for obesity in terms of how you can detoxify. If your gut's not working, you can't detoxify well. If you have a leaky gut or an inflamed gut lining, you can't absorb your nutrients well, like the D and the C. And if you have the wrong bacteria or an excessive of yeast, you're not going to be able to process your carbohydrates well. So it's so important to look at the gut health. In terms of probiotics, I'm a big fan of food, but Akkermansia is one probiotic that's got a lot of attention in terms of helping you with insulin regulation and processing your nutrients.
Yeah, a lot of acclaim as it relates to leaky gut, right? Managing that protective barrier.
Correct. Managing that and then kind of mimicking what these big class of medications, the GLP-1 medications are, which help lower your insulin levels, that it could potentially help. But for kids, I would really say really focus on diet and nutrition and real food.
Right. Okay, amazing. What's the tip of the day? I think we should start to wrap this up because I feel like we're holding the doctor hostage here.
We'll probably do this for the next couple of hours. It's so important.
All right, so I'm going to summarize just a few of the key takeaways. Yeah. Number one, wherever possible, remove the plastic, switch to glass, stainless steel in the kitchen.
Exactly.
Yeah. Fragrance free.
Yeah.
Yeah. I mean, the fragrance, if you can smell it, it's in your brain already. Right. Filter the water. Yeah. Clean water, critical. And then avoid the nonstick cookware.
Absolutely.
Yeah. Four easy steps.
And I know you would prioritize organic in there, organic foods, both of you would. So much we talked about.
Yes, and I think the last thing is control stress perception.
Right. a good resource for parents of young children to read or go to?
Yes.
Or
I think there's a great book by Dr. Alyssa Song called
she's going to be on the show.
Oh, great. She's great. I know her well. Healthy Kids, Happy Kids, I think it's called. She just has really nice practical things in there that I really, I've enjoyed reading. And I think that's an important resource that's easy. And she has a really good little blueprints and hacks that I think any parent could take advantage of.
Amazing. Wow, your wealth of information. You're in the local LA area.
Yeah.
How do people get a hold of you?
At cyanamedical.com or at cyanamedical as an Instagram handle. I'm right here in Los Angeles. Unfortunately, post-fire, because we had this devastating fire in January, we've seen a lot more toxic burden in LA. We were the most polluted city in the US. Now we have the fires. So definitely don't forget about toxins.
Right. Unfortunately, it's ravaged a huge percentage, including Dr. Murray's own property.
Sorry.
But he's bounced back. And
He's resilient.
Exactly.
No, thank you so much for joining us. I mean, it's we're both naturopathic, so we came from that background. But to see someone with your training, your background in regular orthomolecular medicine,
Right.
and then to come full circle into functional medicine, I think you have a bigger perspective than most doctors I've met. So I'm much appreciated, and thanks for bringing your wisdom.
Thanks so much for having me. A lot of patients always ask, like, what is functional medicine? What's internal medicine? It should just be good medicine.
Yeah, it's just best practices.
Exactly.
Well, that was incredible. Thank you so much for joining us today. Wealth of information. Folks, if you could take one step today to change the trajectory of your child's life, you'd want to start with awareness, just like you said, Dr. Sayana, earlier on. Swap out plastics best you can, clean up your pantry, and prioritize real, whole, organic foods. Small changes now can prevent lifelong challenges. So visit cyanamedical.com to learn more about Dr. Sayana's approach to reversing childhood and obesity from any age and stage. Building lasting resilience. That's what she's all about. Remember, the first 7 years matter perhaps the most. Let's make them count. Don't forget to click below, subscribe, and stay connected for more tips on raising healthier, stronger kids. Stay well.
Awesome.